In this slide, I would like to present the problem statement of the project. The case studied in the project is suicide cases of young girls uplifting in America in 2014. A lot of factors contribute to this sudden rise. According to the statistics presented, in a quarter, it was noted that 13 in every 1 lakh people commit suicide in America. The age group highly experiencing this issue is between 10 to 14. The description of the crisis ahead is discussed in detail. The genders that highly cast to suicide are depressed women and girls. The uplift in suicide is considered a leading healthcare issue as it affects the mental and physical health of women and girls. The contributing factors to increasing suicide cases of young girls include poverty, lack of education and awareness, alcohol and drug problems, depression, violence, and others. The core of the SEM model in the young girls who commit suicide due to specific reasons. The reason may be that the individual be at the individual level based on an interpersonal relationship with others, relationship with organization, community, and public policy. The social risk factors which may affect the life of a person are bullying, social isolation, sexual orientation, personality disorder, psychosocial stressors, social isolation, dysfunctional family dynamic, previous suicide attempts, lack of access to mental health care, psychosocial stressors, and availability of means to committing suicide. This slide presents some effective interventions that help in eliminating the uplifted suicide rates. These interventions included Healthy Women, Healthy Families Project, community-based interventions, and Nurture New Jersey. These interventions work to provide awareness as well as assistance to decrease increasing suicide rates. The interventions give donations to the healthcare professionals and organization. The awareness and the educational session due to the interventions helped in providing information. In this slide, the evaluation of implemented interventions is conducted. The results of the implemented intervention are presented. The reduction in mortality as well as other problems was the result of interventions. The development of law in regards to infant health and maternal material who took place due to interventions. The African American women in America were provided with this information sessions that helped in giving awareness. Furthermore, I would like to present some challenges and solutions to these challenges faced during the implementation of the interventions. The leading difficulties include resource allocation, lack of knowledge of modern innovative technology. The problem in tracking the referral to healthcare professionals and organization is also among the most significant challenges. These suitable solutions include gaining a proper understanding of information technology, developing a strategic plan for the intervention, and resource allocation. The use of the social media to finding referrals is among the most suitable solutions. In this slide, I would like to present the logic model concerning the project. The input of the program is the resources that are required to implement the project. The information of the intervention includes referrals to organizations that provide social services to assist low income. It also includes dealing with high-risk birth outcomes and postpartum care. The input of current interventions includes giving knowledge to the women that are threatened and living with depression. The activities that are required for proper implementation of educational and informative sessions. The activities include educational assessing, targeting the selected audience, and making contacts with referrals. The outcome of the logic model provides for the achievement of the objectives of interventions. The result of the intervention was the development of the law regarding women and infants, services to women, reduction in suicide.